The study implied that there was a genetic component in the development of familial cases of TEC. And just anyone like to hazard that this may be and not from my table, please? Yes. Gepner in 1990.
Another question is about etiology. So if you take the serum and place it with TEC and you stick it you stick it in erythroid colonies from somebody else, does it suppress erythroid colony growth?
So there is reports of reduced erythroid growth in people who've got TEC. I don't know what it does when you put that into someone else's. I don't know if that answers the question, but it might.
Problem with a lot of human serum will inhibit, it's variable. So you can just take normal people's serum and they'll inhibit some other erythropoiesis. So it's not a very good test.
Just a comment about the questions, because this is being transmitted, televised to Tassie. If there's any questions, if people can use the microphone so they can hear.
So I'm going through a few kind of cohorts of studies, and some of them are a little bit old, but they seem to show a number of classic features. So Skettner in 1993 did a retrospective study of the incidence of TEC in Sweden. They had 53 cases. They were all less than 10 years of age, and 96% were less than 3 years of age. The incidence was about 4.3 per 100,000. The median hemoglobin at diagnosis was 65, and they had kind of a marked anemia with a hemoglobin of less than 40. The reticulocyte count in 80% was less than 1%, and neutropenia and thrombocytosis were a common finding. They didn't actually give numbers there, so I can't report those. The prognosis of these children, so 37 out of the 53 were transfused. 9 received steroids, but they didn't really seem to have been important for the children to recover. 7 did not receive any treatment, and in those treatment who've not had either transfusion or steroids, then reticulocytosis or an increase in hemoglobin occurred after 0 to about a month, and the median was about 8 days. All children recovered, and there was no complications or relapse seen. Skettner also described 2 children with a sibling who had previously been diagnosed with TEC, and 1 pair of identical twins simultaneously had TEC. So there appeared to be this higher familial occurrence than expected. Skettner later went on in 2002 to do a prospective study looking at 10 consecutive children with TEC, looked at doing serological assays and PCR for parvovirus, HHV6, CMV, and EBV, and looked for isolation of the virus in the bone marrow, the stools, and MPA. The viral testing showed 1 child had an acute EBV infection. There were no instances of IgM positivity for any of the viruses, and a few children had IgG positivity for HHV6, EBV, and CMV, but it's not really clear when they had become positive for IgG. That could have been a past infection from a while ago, and there were no positive PCR results. So this lack of positive viral markers, is this because there's a delay between the erythropoietic arrest and the appearance of marked anemia? So it would take about 60 days to reduce the hemoglobin to half its normal amount. And a pathogenic viral process may have occurred 1 to 3 months before the actual diagnosis of TEC. By the time we've performed a viral test, it's probably going to be unlikely that the IgM and PCR are positive. Cherrick in 1994 looked at 50 patients with TEC. They had a mean diagnosis of 22.3 months with a slight increase in females to male diagnosed. And I'll just put you to the hematological data here. So we can see they had 2 groups. One was a group of patients who were reticulocytopenic, and the second group on the right were a group that were having a reticulocytosis. It sounded like they were in the recovery stages of the TEC. We look at the hemoglobin diagnosis, we can see on the left we've got a hemoglobin of 68, and MCV, which is normal at 80.9, reticulocytes of 0.2. The ANCs are 1.9, and there's a difference between the two groups. And we can see also a difference in the fetal hemoglobin. Just, it was not significant, but there was a trend, which is about not a nice, no one likes using that word, but they look to be lower in terms of the numbers. When we did bone marrow,